Hello everyone, and welcome to this presentation on facilitating a healthy professional role transition for newly graduated nurses. I wanted to start by kind of contextualizing where we are at currently in the conditions of the workplace and nursing as a profession. And so I have chosen some recent significant reports and studies in Canada, the US, and Australia, because I think the majority of work being done with newly graduated nurses exists within those countries. And so using that as a backdrop, I think it's important for us to understand that there have been a lot of changes that have gone on in the perceptions of the workplace at the same time as the workplace itself is changing. And I'm not sure that those are going in the same direction. And I think that's part of the challenge that we're having. Certainly there have been a lot of, and I think everyone across the country has been experiencing this pre-graduate and graduate premature withdrawals from their educational programs. I see a significant number of reductions in educational program applications, and that is not a good scenario for us given that we're already dealing or trying to deal with the attrition of mid to late career nurses out of the workplace. And speaking of that, there have been incredible exits of nurses out of the workplace, primarily because of the stress and the work overload involved in both the academic and the industry side of our nursing context. I mean, there's a lot of research out there, and even since COVID hit, to talk to us about the job strain, the role tension, the need to balance work and family conflicts. And that's particularly problematic for the upcoming generation because they're very sensitive to that balance, and they're growing up in this incredibly stressful environment, and they're trying to mitigate that stress. They're trying to pace themselves. And so what I'm finding in the workplace is we either pace with and for them, or they will pace themselves. And sadly, we won't have much control over the situation if they make a decision to pace themselves. There is this tremendous loss of intellectual capacity and capital, and it concerns me a great deal because when you think about mentoring these young nurses and helping them even with the development of practice patterns, that's a hard thing to do if you don't have people that have been in practice for a while. We all know that there are workload safety concerns, and those are related to the shortage, but they're also related to the conditions of work with or without a shortage. And I do think that we need to separate those because the reason for the poor conditions is not just the fact that we have a shortage. We have to take some accountability for what we're doing to create a workplace that's worth waking up to. During the COVID period initially, like in the 2020 to 2022, there were a lot of redeployment challenges. So there was shifting, a lot of pivoting by workplaces, and subsequently nurses were moved around a fair bit. And that was certainly a problem for new graduates. Even if the new graduates were kept in the units where they were hired onto, the people they depended on to mentor them were deployed. So either way, the new graduates struggled with knowledge development because they didn't necessarily have the mentorship that they needed to assist them with those practice patterns. Certainly we are concerned everywhere about the span of control of nurses at the bedside, that they are working with too many patients under their care at any given time. And I think that that's driving a lot of the ratio mandates that we're seeing, not only in a fight for those in Canada, but across the US. I believe that there is a devaluing and a disrespect being shown to nurses in the workplace, even by virtue of the lack of mitigation of the challenges that they seem to be talking about constantly. the devastating data that's coming out of a variety of organizations that speaks to the flailing mental health of healthcare professionals in general, but nurses in particular. And I do think that students see that when they're in their undergraduate programs, and that's problematic because certainly what I've heard and seen is that before they even get into practice, they're being socialized to feel concerned about what they're going to face when they do get into the workplace. So this is an interesting context that we're laying out for these young nurses. There are many reports of racialized and gender-based discrimination in the workplace, and certainly that the word and the idea of discrimination has become far more fluid, I think, with this newest generation, which I'll talk about shortly. But their threshold for that is far narrower than our threshold has ever been. I think that's obviously a very good social development. But having said that, I don't think that we're necessarily ready for that as a society. And I think that our movement toward this tolerance and acceptance, not just tolerance, really, it's acceptance of people as they are in terms of gender, ethnicity, culture, politics, economics. I think we're behind where these young people are. Certainly there's a data lag, and I don't find that as much in the US as I'm finding in Canada. We seem to be a little bit behind our understanding of the changing resource demographic and context. So I'm hoping that we'll start to see more research around that in short order. There does tend to be a focus on recruitment over retention, and this is I suppose a rather covert way of disrespecting the knowledge capital that is already in the workplace. Is that if you sort of hire someone or you sell them a car and then you don't service it, it doesn't make them feel like you really are interested in their well-being. And so I think, this idea of we don't just need to hire individuals into these positions, but we need to produce and consult with them about a workplace that makes them feel respected and valued and purposeful. I'll speak also about that in this younger generation, but that sense of purpose is critical to the retention of these newest graduates. And finally, there is a lack of understanding about generational work characteristics, and we don't have as many generations in the workplace. We did have all four in the workplace before the massive attrition of the mid to late career nurses. And now we have a lot of Generation X, Generation Z, and Millennials. Those are primarily what you're seeing in the workplace. So if we think about what we've talked about in terms of the context of practice, we have to ask ourselves why we should be so concerned about the transition experience of the newly graduated nurse. And I guess I'll start by saying that the majority of new graduates will make their entry to practice in the acute care environment, which is the one I think that's struggling the most right now. Certainly, I think there are ripple effects into the community, public health, etc. But primarily the challenges to workload are coming in acute care where we're less able to control them. There are early career attrition rates that are increasing, and that of course is most concerning because we've invested a fair bit in them by the time they finish their orientation and maybe spend a year in practice. And then if they are not feeling like they are attaining the kinds of purpose that they're looking for, they begin to question their decision to be in an acute care environment. The stress that's involved is really difficult for them to handle. They're not a generation, I think, that has been taught or has had enough time even to adjust to the stress of their environment. it's always something that's coming in, and I feel like they don't have time to recover. So I believe that that's one of the reasons why there's so much expression of inadequate coping mechanisms in this newest generation. Certainly, healthcare acuity, clinical complexity, the level of chaos have increased exponentially, and COVID really tipped us over the edge. I don't think there's a practitioner out there that would disagree with me that these issues were all present before COVID, but it's like they were underneath the surface, and we could mitigate them, we could navigate them, we could cope with them. But I think COVID stressed our systems so much, it just really fractured what we had in place. And that's, I think, another reason why we are experiencing so much difficulty now. The staffing shortages that we had before COVID were certainly exacerbated and intensified by COVID in primarily the realm of the increase in workload and the fact that new graduates coming into the workplace didn't have the kind of supports that they needed. They were just trying to cope with their own personal response to COVID, and there were multiple generations having different expectations and ways of coping with COVID. And I always say to people, the thing that was different about COVID than anything else that stressed our workplaces in the past is that it was both personal and professional. Every practitioner that was dealing with a COVID patient was also experiencing COVID themselves, going home and, changing in their garages, not seeing their families. The destabilization of what was a fragile healthcare system tipped it certainly over the edge. We were seeing some changing demography in our healthcare workplaces. We do need some more forecasting around that, and that speaks to my prior comment about the data, that we seem to be behind the data when it comes to responding appropriately to the challenges that we're facing. There's a fair bit of exhaustion within the workforce, and some of that is being expressed by the exit of nurses out of the workforce, but other is being expressed by infighting and burnout and cross-violent behaviors. So I do think it's important that we recognize the significance of the mental health challenges in the workplace right now, and we do whatever we can to try to address those challenges. I think that it's hard to engage and grow partnerships and relationships when you don't necessarily have the intellectual capital in your workforce to support that mentorship and that preceptorship and that kind of support. But I think that residency programs, some formalized mentorship, preceptorship program or transition support program that is grounded in the stages of transition and transition shock on both sides. So for both the mentor and the mentee, everyone needs to be on the same page, because the way that you work with a new graduate in their first stage of transition is very different from how you would work with them, or even the expectations you would have of that graduate when they move into their second stage or third stage of transition. I think the systems themselves are being stressed and strained. I mean, we have limitations to our fiscal capabilities. We don't have endless finances with which to support initiatives. So we have to start thinking very carefully, and I'm not even suggesting that it's an easy decision for administrators to make to move resources from one area to another, because that just means someone's getting something but someone's losing something, and those are difficult decisions to make. And I think that we need to make certain decisions that provide that support in the workplace right now, and perhaps once that support is a sustainable momentum, that you can start to move those resources to other systems of support within the workplace. Educational foundations of nurses have been shaken, I think, in the COVID and post-COVID period of time, because we know that COVID altered our ability to engage in face-to-face education. It limited our practice capacity, sending students into the clinical areas. SIM became, thank goodness we have SIM, but SIM became really the gold standard of teaching people clinical relationships, clinical interactions, clinical skills and performance in clinical. And we all know as nurses that that is more contrived, it's a bit more prescribed, and it's more difficult to integrate and even demonstrate the human condition in a simulated environment. And we know that the human element is highly emotionally and emotively charged. It's intimate, and you know that really changes the relationship that you have as a newly graduated nurse who's uncomfortable with their practice environment, to be thrown into a relational situation that's dynamic, that's stressful, and that's conflict laden. So those pieces can't really come across as well in SIM as they are in a practice environment, and those have been limited, and I think we'll continue to have some limitation in our ability to send students into the practice area. I've been doing this research for a long time, for about 25 years, and I'd like to think so much has changed, but I have to say not that much has changed. And I think perhaps the reason why I feel so strongly about Nursing the Future and what we need to do to support newly graduated nurses and those who support them is because not as much has changed as I would have liked to see. And I think COVID, even if things were on the mend and we were, moving in the right direction, COVID just really pulled the rug out from under us. So I think we have a lot of recovery to do. But it is a very difficult experience for new nurses to come into practice today. It was just intended to demonstrate the very confusing messages that new graduates often get when they arrive in practice, and they're not as able to distill out the messages as someone who is seasoned. That multitasking, what Patricia Ebright from the University of Indiana refers to as stacking, that new graduate's ability to walk in, have a sense of what's happening, but then when they enter that practice area after they've received report and everything has changed, reorganizing that can be very confusing, frustrating, and overwhelming. Over many years of talking with senior students about the anticipated experience of making their professional role transition, I've learned a fair bit, but it's been quite consistent and probably not surprising. I think they feel they're not prepared adequately, and I try to distinguish for them that being prepared is different than being ready. I think that schools of nursing that are accredited have gone through a very rigorous process whereby experts have determined that yes, this program should adequately and to the best of our ability optimally prepare that graduate to practice in the contemporary practice environment. That does not necessarily mean that when a student graduates that they're actually ready to walk into that environment. And certainly the preparatory anxiety that students are feeling now because of the exposure to these stressful environments when they're in their clinicals, I think are inspiring a lot more anxiety in them as they prepare to enter practice. But certainly they describe themselves as not having enough critical thinking skills. And this is another thing I try to explain to them, that they have critical thinking to the degree and within the boundaries of their current knowledge. But as we all know, critical thinking is a process of taking options, examining those options, trying to understand what's the best option, being able to institute a praxical process whereby you enter an environment, you say, oh, that didn't work, you come back out, you revise your thought, and your pattern recognition, as Benner has pointed out, expands as your practice expands. So having critical thinking skills is largely dependent on having a fair bit of knowledge, and that knowledge is only acquired once those graduates are truly in the practice environment. I don't think there's enough time to give them all the science and biomedical knowledge that they need, or quite frankly, the community knowledge or the relational knowledge that they need to practice as professionals. But is it enough for them to enter as entry to practice practitioners? Absolutely. Do we treat them like entry to practice practitioners? Maybe we need to think about what we're expecting of them when they first come into practice. They certainly feel like they are not prepared to practice within the clinical environment, and many of them cite their experiences outside of the practical environment in simulation, in classrooms, online learning, virtual classrooms as contributing to that. And certainly there's evidence there now to suggest that while we didn't have a lot of options at the time, it's probably not the optimal way of educating students in the long run, particularly when it comes to getting practice experience. Are they being placed in over their head? They certainly feel that way, and I would suggest that there are some contexts in which they are over their head, and I'll speak to the importance of the foundational elements of what a new graduate needs to be successful and whether or not we are thinking about those. And one of them is stability. So how much instability are we expecting the new graduates to deal with in terms of their practice environment that we might need to control a little bit better. The concerns that they have about practice are coming from concerns with their colleagues who say, I don't have enough time, I've got too many patients, and I'm afraid that because of that, I'm going to make an error and I'm going to lose my license. So there's a fair bit of narrative around that right now in the environment that students are learning in. Enculturation concerns are always there when it comes to a new nursing graduate. This idea of fitting in is incredibly important to them. In fact, it supersedes a lot of other experiences and feelings that they're having. It's almost a lens with which they see what they're doing, particularly in the first stage of practice, is if I do this, what will it mean for my acceptance by my colleagues? Because that is absolutely their objective for the first, at least for the first 4 to 6 months. Burnout is being talked about a fair bit right now, and not just with new graduates. And I would suggest that new graduates get very stressed, they get overwhelmed, but burnout is a more long-term experience. And so do I think that they can burn out in the first couple of months? I'm not an expert on burnout, but I would suggest that that isn't necessarily burnout, but an incompatibility between what they expect and what they want, and then what they experience when they get in there. Burnout certainly will come over time if the issues that are driving their stress are not addressed. The importance of a new graduate having time to learn, they're learning, well, none of our learning ends when we graduate from our undergraduate degrees, but Certainly being thrown into practice and being expected to take a full patient load, to understand how to deal with complex, chaotic environments is not something that we should expect. But the challenge is if we don't have enough people out there to support them, and we don't have the workload capacity to mentor them, then in fact they don't have time to learn. And what does that mean for them down the road? So if they don't have time to reflect with a seasoned practitioner on the way something went, my larger concern is that they're establishing practice patterns that are not accurate or just suboptimal. And they're taking those practices forward because they don't know any better. And once they take them forward, the chance that they're going to spend time reflecting on them are far less. So I do think that it's imperative that we address the issues related to their ability to reflect on their practice with someone senior. So while we have multiple generations in the workplace, primarily we're looking at Generation X, Millennials, and Generation Z. And the graduates, the new graduates coming out right now, are primarily Generation Z. So I thought we should talk a little bit about who exactly they are. And the title that comes from the Pew Research Center really says it all. On the cusp of adulthood, and many of the new graduates that have been in my studies have described this period of growing up in their transition experience. So this idea of moving away from home and being out on their own for the first time is not uncommon. And so when you think about these young individuals growing up in this very uncertain environment and their futures, when they're facing war and economic collapse and environmental disasters, it's fairly understandable that they would feel a little bit anxious. Having said that, it's also molding their social structure and their understanding of their world. So I wanted to talk a little bit about what some of that looked like. To begin with, those coming out into the workforce have been deeply affected by COVID. That might be emotionally, physically, economically, and I'm sure their parents were quite involved and quite affected by COVID, which means they were vicariously, if not secondarily. They do tend to be, and this has been increasing over the last decade, where we see more racially and ethnically diverse populations than any other generation. Certainly their access to education, and this is speaking generally because it's certainly not in all areas of all countries for sure, but they are the best educated generation, and that is not just formal education, but rather their access to information and networks of information is just endless when you think about the web possibilities. Speaking of that, they're what we call digital natives, meaning that's kind of who they are. They're grounded in IT, they're grounded in technology, and they don't even know the world without a phone, without a smartphone. Many of them without access to multiple sources of information, and even developing countries. It's fascinating to watch that because they might not have food or clothing, but they have technology. This group is highly aware because there's so much media out there right now, and I think that our ability to share information makes them even more aware of the inequities and inequalities that they're seeing around the world, the hypocrisy that they see around the world, and how that challenges their ability to accept opinions, to accept authority as knowing and trustworthy. Certainly their stressors are dominated by insults and assaults to their understanding of their own economic, political, environmental stability. And they see cultural and social diversity as benefiting society. So they're not nearly as rigid about things that are changing, although they're very sensitive to whether or not that change makes sense for everyone, whether it is inclusive, whether it is respectful. And so this idea of just accepting the changes that we ask them to partake in, you'll see this in students. The students will rise up very often against things that they don't understand or perhaps don't agree with. Their views about work. This is obviously very important for us to understand about newly graduated nurses moving into the professional practice arena. But they're purpose-driven, they're socially sustained, so they're very about the people around them and about having relationships with people around them. And most certainly they're conflict and stress avoidant. So they won't necessarily deal well with the stressors in the workplace. So they need to be armed with strategies, and they need that kind of support attending to their emotive experiences primarily. They are very consultative, and they're team oriented, so they would like to be working with other people, unlike the Xers. And the Xers were pretty much nomadic. They just didn't belong to any one particular group. Generation Z, like millennials, they share this with millennials, and that is that they like to be involved in groups. And so the acceptance of them socially in their professional environment is very important to them. So ensuring that you do things to make them feel welcome, you pull them into social structures and bring them along with you when you're going out after work. Those are things that would be very important to their sense of belonging. They are certainly multi-identifiers, and some people call them identity nomads, so that they don't want to be put into a particular group, and so that if they choose to change, that they'll be accepted for that change. And fundamentally, they are pragmatic. Things need to make sense to them. They will follow rules if they understand them and they feel like they make sense, and that they are attending to a balanced perspective. They do want to be heard, like everybody wants to be heard, but they will definitely be looking for a work-life balance. And I've heard numerous times from new graduates that is what is driving them out of the workforce. To the nitty-gritty of the stages of transition and my work. So I'm going to talk about the 3 stages of transition and the particular components of each stage and important elements to understand in each stage. To begin with, transition shock is the initial experience of entering the workforce and the workplace. This generally occurs after the orientation period has commenced. So when they're on their own and the expectations are that they will be practicing like a professional practitioner. The transition shock experience usually occurs within weeks and maybe even days, but doesn't last very long. And this is assuming that a lot of the challenges that they have in their transition shock experience are being mitigated. So as you can see by this, there are 4 quadrants of influence for the newly graduated nurse: their knowledge and their ability to apply that knowledge, relationships, which involve personal and professional relationships, and the level of social maturity that they come into the workplace with. Roles, what roles they have had in that particular unit or work context. Perhaps they've been an LPN there, perhaps they've been a unit aide or a healthcare aide. And if they have, then some of that role confusion might be a bit surprising to them. Even the role confusion of those who work with them about what role they're playing that particular day. Or seeing them as the newly graduated professional that they are, and not, for instance, the healthcare aide that is there to assist everybody else. That they have their own workload, they have their own responsibilities. That's just one piece of the roles, because there are multiple roles that the nurses will take on depending on the unit that they work on, and those roles need to be very clear for them, and sometimes it takes a while for them to adjust to those roles. And finally, responsibilities. That will vary tremendously between units and between workplace contexts. Certainly understanding that they have responsibilities now at home that they might not have had before. So once their schooling is done, friends, family, significant others tend to think, okay, well, you're a graduate now, and so you can start taking on all of these other responsibilities in your personal life, that they don't realize that their transition is going to be a fairly stressful period of time, and that maybe they're not ready to take on all those roles. So knowing what's going on for that graduate personally is my message behind the transition shock construct, is that there's a lot going on for that graduate, and your ability to understand which of these four quadrants is most problematic will allow you to direct and target the resources that you have to be more effective for that graduate. So the transition shock experience as a whole is as it looks, which is volatile and acute and stressful. So for the most part, they have an overwhelming sense of fear that they're going to make a mistake, fear that they're not going to be accepted. It's a time of great emotional upheaval, and that's why I talk a lot to them about, cutting themselves some slack and being a little bit generous with themselves when it comes to their mental health and their self-care during these initial weeks and initial early months. They will be physically exhausted. The emotion is exhausting them physically, and the fact that they're working usually 12-hour shifts, and if not, the intensity of their work, regardless of how long it is far greater than it ever was when they were a student. So recognizing that that's going to be a challenge for them will help you to direct them to think about how are they taking care of themselves, because if they don't take care of themselves, they're not going to be available to you in the workplace. Understand that they will be very distracted by the tasks that they need to do. The first reason for this is that those tasks are obvious. So what they're thinking about the tasks and the decisions that they're making that feed those tasks, you can't see, but you can see what they're doing. So they know that, and the visibility of the task performance is very stressful for them because they know they're being watched and judged, understandably. I try to explain to them that when people are working alongside you, they need to trust you. They need to know that what you're doing is appropriate, and they're there to say, hey, like, I wouldn't do it that way, and here's why I wouldn't do it that way, or here's what I would do, or why are you doing it that way? That is not always a criticism. Sometimes it's just a curiosity and a query and an attempt to enhance and optimize their practice. But they don't always see it that way, so they're pretty sensitive in that early period. They will most likely be a bit disoriented because, like, literally they were a student who had the support of faculty one minute, and the next they're on their own. So that's a bit disorienting. Who do I go to when they turn around to find the support and it's not there? That's sometimes, hard for them to process, and they're just adjusting to that, of course. And like I said, they were a student, and now they're newly graduated nurse, so their identity has not yet developed in terms of who they are as a professional person. And I put doubt and loss in there because I feel like people need to appreciate that they are grieving the loss of the life that they just left. And they had a well-established life, generally 3 to 4 years of undergraduate study, where they got into a routine, they got to know the people that they were working with, and now that's not familiar to them. Many times the graduates are not able to get the support from their peers that they went through the past 4 years with, because everyone's working a different shift, maybe even in a different location. So this gives you a little bit of a sense of their transition shock experience. This slide gives you a slightly different visual of the stages of transition over that first 12 months, but it does give you a sense of what the crisis periods are along the way. So they start out in stage 1, and I've identified it as the doing stage because the focus is on their practical skills, their performance. And I'll talk more about each of these stages as we go along here. But within that initial stage is when transition shock hits them, and it is very rare and certainly concerning if the graduate was to extend that transition shock beyond a couple of months. And so I think just their sense of themselves starting to evolve, their comfort level with responsibilities should give you a sense that they are moving along. And if they do not reach that second stage, and I'll talk a little bit about what changes you'll see from stage 1 to stage 2, then you need to start asking yourself why that's the case. What is it that's keeping them back in that initial stage? And we'll talk about that. Within the second stage, there's another period called the transition crisis. And I try to distinguish these for everyone by saying that shock is generally this idea of, oh my goodness, I don't know if I can do this. That's that initial overwhelming sense that I said was driven largely by fear of being inadequate or incompetent. Crisis is more like they've become accustomed to their roles and responsibilities. They're feeling a little bit of confidence, but then they take a look around them and they see how different what they're expected to do is from the reality that they had anticipated. And they might see the workplace, the healthcare system, generally for what it is, which is an imperfect system that is not perhaps allowing them to practice the way they want to. And that will be received variably by different graduates, depending on how invested they were in, this is what I want. If I don't get this, I'm not interested. This is where you really need to watch them very carefully, because if you don't know what they're experiencing at this point, chances are you will lose individuals that could be on the fence that you might be able to help mitigate through their transition crisis. And so the transition crisis, unlike shock, which is I don't know if I can do this, is more I don't know if I want to do this. And that is a far more difficult problem to solve. And so watching them carefully, debriefing with them, getting a sense of where are you at, how do you feel about your practice, would be very important to help them through this particular crisis. The next two slides speak to two fundamental findings of my work over the last 25 years. The first is that there are categories of influence that will impact the way and the reasons why new graduates struggle or succeed. The next slide is the foundational elements, which is what does success look like if you're balancing out the experience of the newly graduated nurse. So let's just talk briefly And I should mention that the book that you'll see under the transition theories section of the website goes into a significant amount of detail when it comes to all of the information I'm talking about today. So if you want to dig deeper into roles, responsibilities, relationships, and knowledge, then you'll do so through the book. This has also been what I presented in the transition shock depiction, because as soon as they get in, you start to see which of these elements and which of these categories is influencing the transition shock experience for them. So for instance, they might be very comfortable with their knowledge level, but they're very uncomfortable with their relationships. So if we hit them with a lot of knowledge support, but don't recognize that relationships are problematic for them, then we're missing the boat with that particular graduate. So I don't think that it's a one size fits all for these graduates. I think that if we understand the roles, relationships, responsibilities, and knowledge, then we will target resources appropriately, which is not only effective for them, but it's efficient for us. I do want to point out that I have a professional role transition scale that has been validated and is available for use. If you're interested in contacting me about that, then it allows you to measure which of these 4 categories are most problematic for the graduate and target the resources appropriately. So feel free to contact me. As I mentioned, there are foundational elements of success for the newly graduated nurse, and they're not that complicated. Stability, predictability, consistency, and familiarity, and I've outlined them here. And it's important that when you are thinking about workload or even situating the graduate in a particular workplace context, that you think about how stable is it, how predictable is it, how familiar is it, how consistent is it. I'll give you an example. New graduates in the float pool generally doesn't feed any of these foundational elements. So they don't have any predictability about who they're going to work with, what patients they're going to take care of. Many times the familiarity is not there for them because they haven't been to this unit in 3 months since they were last there. So getting to know people has been difficult for them. So things are unfamiliar. And then we come into the inconsistency, where they're going to different units every day or every week, and it makes it hard for them to establish relationships and patterns of recognition in their clinical development, and that's problematic. And finally, stability, which is, for those of you who have read my work on the emergency room for newly graduated nurses will know that my research suggests that that's probably not the best place for a graduate, because it doesn't allow them the latitude to develop their clinical skills without being under a certain amount of clinical pressure. And the risks are high. And when you have high risk situations with a new graduate that you can't contain and control, and they don't go well, or you don't even know how they go, then the graduate is at significant risk there. So the last thing I want to mention about the foundational elements is something I've mentioned before, and that is that this is as personal an experience for the graduate as it is professional. So when you think about all of these foundational elements, they are referencing their personal life as well. So unlike the way it was when I entered practice and nobody was interested in who I was as a person, it's just get the job done. And the demographic these days is different. I would recommend that you get to know the graduate. The graduate is a personal being. And this particular generation is a very personal being that drives who they are and what they want in the workplace and what they're willing to do for the workplace. So if you know them, you're far more likely to help them succeed, and you're far more likely to be able to predict their behavior. So now we're going to start talking about each of the stages. And there are 3 stages, and I'll start with the doing stage. As I mentioned at the outset, the doing stage begins after they have completed their orientation and they are fundamentally in an independent practice position. Now, the doing stage is named that way because it is all about task performance and understanding roles and relationships, perhaps in a more linear way. They will be focused on tasks. They will do what they know. And it's interesting when you explain this to seasoned nurses who might feel a bit threatened by the fact that the graduate is coming to them with, well, this is the way we learned it in school, and this is what the latest evidence shows, et cetera, and that is perceived in a threatening way, or who do you think you're talking to, telling me what is evidence? But that's all they know. They know the evidence, they know what they were taught, and so they're coming into practice with that idea in their mind. So if you expect it and understand it, then it won't be perceived as threatening by the nurses that they work with. For sure, there are many things that are different between what they experienced in school and now what they're seeing in the workplace. They don't oftentimes know their colleagues, and this is where the advantage of being an enrolled student nurse, or having a role as a practitioner while still going to school, whatever you happen to call that, or doing a senior practicum in the area to which they're going to transition is really helpful, because the idea of being familiar with the people where everything is, that reduces a fair bit of their stress in this early time where they'll be so focused on learning how to do what they need to do as a fully functioning nurse with a full workload. They will doubt themselves. This is absolutely normal. And a graduate with little confidence in this particular stage may not present quite the way you think they will. So they may come across as though they know what they're doing, but if you touch underneath the surface a little bit, they don't. And they don't feel that way. They feel very fragile, and they cry very easily. They usually will go home and think endlessly about what happened that day. They will dream about it. They are exhausted because that's what they spend all their days doing. And if they come back into the workplace during this stage and they're faced with all the things that they didn't do and no sort of positive reinforcement, the likelihood that they will feel successful, which is what our goal is less. They are asking themselves, in the face of an environment that looks so different from what they thought was going to happen, they're asking themselves, what is this, and what does a nurse do, and is that what I can do or want to do? Who am I as a nurse? If I look around me and I see this nurse practicing and that nurse practicing and everyone's doing something slightly different, where do I fit in all of that? And many of them feel overwhelmed. If you understand that the first stage is going to be the way that I describe it, then you'll understand why they're so exhausted when they get to about 4 months. And I always tell new graduates or senior students to book themselves a spa appointment or some sort of trip or some sort of relaxing, whatever that means to you, at about 4 months, because they're going to need that. If a graduate in that first stage is not getting the support they need and people aren't recognizing the normalcy of that transition for them, they won't necessarily transition smoothly into this second stage, which is really important. Expect them to go through that, but hopefully by the time they've reached about 4 months, you're going to start to see them settle in, have a little bit more confidence, not be as exhausted, not be as emotional, enjoying themselves, maybe socializing a little bit with the staff, and certainly managing their workload, which means they're taking their breaks, they're not having to stay at the end of the shift to finish their charting or whatever. Those are signs that they're still not coping well with what's going on. And again, having an in-depth and personal conversation with them, letting them know that you care about them and that you're wondering how they're doing, will allow them very easily usually to open up to someone like that. So if they've done that successfully, we're going to move into the being stage. In the being stage, the graduate has, just as you have just experienced, come through a very traumatic 4 months. head down, just do what I need to do to get through my shift and my shifts and the last 4 months. I am exhausted, and I might start to pull back from my environment because I'm overwhelmed by what has just happened. And it's one of those, holy crackers, what have I done? What went on there? And now they're going to start to make sense of that experience and their environment. They will re-enter. I've not seen a graduate not re-enter, but it needs to be on their own terms. And as I'll show in the depiction of the next slide, oftentimes what's happening here is they're in a crisis of confidence, they're in a crisis of identification, they're in a crisis of consolidation between what they thought their profession was going to be and what they have now come to understand that it is. And they have to find their way to a settled place where it's okay. If they don't find their way there and they can't make sense of it, or they can't justify the differences and the challenges of their practice, they will probably go on to feel dissatisfied with their work and perhaps look elsewhere for employment. So you definitely want to be talking with them, and a seasoned nurse who can say, oh, I was there, and I know it's challenging when you can't spend as much time with your patients, but here's what I do to spend quality time with my patients, and it only takes a couple of minutes. Or, instead of sitting in the nurse's unit area, I'll go and sit down with my patient, grab their chart, and we'll talk for half an hour. Something like that, if you could have seasoned nurses or an educator or the manager spend time with them and say, usually at this point in your transition, you feel a bit unsure about what's gone on, and you're trying to justify and understand and consolidate what you thought was going to happen with what actually is happening. So can we talk a little bit about that? What is it that you're seeing that really surprised you? Are you still able to apply your values that you hold dear as a nurse? Can you still feel confident in saying, I can uphold my values as a nurse? If they say no, you need to have a conversation about that. So that fundamentally is what second stage is all about. It's this sense of making what's happened logical for them, so that they can then move on to create their own sense of identity as a practitioner. They need time to do that here, and this is where, if they've worked a lot of overtime because they're like, oh, I love being a nurse, my first 4 months, and they're taking overtime because they want to be accepted and they want nurses to know that I'm right there with you, but in the meantime they're feeling completely like they're drowning, then this is a time when they really need a break. And they should be encouraged not to work overtime. They should be discouraged, in fact, from taking on responsibilities that are above and beyond just the basic work, because they won't have the same level of energy as they had in the first stage. I always love showing this picture, and we usually have a fair bit of dialogue when I do show it. But it's the perfect depiction by a new graduate that was about 6 months out, relative to what had changed for them. The rows that looked like this when they anticipated graduating, and then the rows as it was when they recognized the realities of their practice. So I won't speak to the metaphor. I'll let you see what you think about that. If the new graduate has been supported through that first stage, has been encouraged to recover in the second stage, they will bridge nicely into this third stage, where you start to really see what kind of a practitioner that new graduate is. And they start to want more at this point. And hopefully that more is not leaving your unit. Hopefully that more is, okay, let's think about maybe increasing the complexity of the patients that you're caring for. Maybe we think about having you act as a preceptor now. If you have the graduate acting as a preceptor, and I know that this is almost inconceivable that the new graduate wouldn't be a preceptor by the time they get to 5 or 6 months of practice, if you can wait until now, they'll be a far better preceptor because they're still really in a learning and a consolidating space in that second stage. And certainly in the first stage, I think it's too much stress for them to be expected to lead other people. So here we have the third stage, which hopefully should see the graduate coming into a wonderful sense of themselves. Now, it's not tied up in the beautiful red bow that it appears to be, but it is a really settling time for them. And as you can see, I outline each of the subcomponents of the stage. And in this case, at the top, you see separating, recovering. These are detailed in my book, but they will give you a sense of what is going on for that new graduate. And you can see it's a bigger picture. It's a stepping back and trying to come to a logical place as they prepare for their future. So this is really the first time that they're starting to think about who they are as a nurse long term and what they want to do with their career. And for a variety of reasons, graduates these days seem to feel that they need to move on pretty quickly. So it wouldn't be a surprise if they decided that they wanted to change units or they wanted to start taking on more responsibility. This is the time to get them involved in, say, unit policy and procedure development, or, like I said, preceptorship training and expanding their body of knowledge. They are starting to want to understand the bigger picture. So even getting them involved in a professional association or a union, something like that. They are going to think about the plans that they have for their future. So once again, you want to be in that conversation with them so that perhaps the challenge that they're looking for can be in your workplace and not somewhere else. Not surprisingly, there are particular drivers of error in the newly graduated nurse that I just really want to speak to. And this is generalized throughout pre-COVID and post-COVID. Certainly their decision-making in general is challenged, particularly in that first 6 to 8 months. And there's a lot of data coming out now, more so now, about the importance of placing them in situations where the complexity and the chaos is manageable in terms of their decision making and their clinical judgment. They can't see multiple options in their decisions because they don't have that kind of portfolio of experience. So decision making in complex situations where diagnostic contexts are multiple, they might have more difficulty making decisions in those situations. Certainly situations that are moving quickly. So instability that is happening quickly is difficult for a newly graduated nurse because they need to spend time thinking about what's happening and what they're going to do about it. Less so, or more so, pardon me, than someone with experience. Marlene Kramer worked extensively with this idea of multiplicity, complexity, and synchronicity. And when I was managing nurses on a cardiology CV surgery unit, I saw this really clear not only in the new graduates, but in early career practicing nurses where, and this is pretty commonplace now given the acuity that we have in the workplace, where multiple things are happening that are complex and they're all happening at the same time. So meaning I've got 3 patients or 2 patients that seem to have really complex issues and they need me to make decisions right now, but they're both happening at the same time. And I don't know which person to see first. I don't know which person or what about that case I could hand to someone else. That is very common and inspires error in the new graduate when put in those situations without some sort of counsel. They have minimal pattern recognition, and I think we need to appreciate that pattern recognition comes with experience, and quite honestly, with an element of failure. I mean, we need to make mistakes, and then we need to learn from them, and then we need to recover from them. And that's how we establish new patterns that allow us to go into the next practice situation with more knowing. That is also what we call tacit knowledge, which you can't have unless you're practicing. Care delays are a source of error that we don't think about all that often, and they're really hard to recognize because there are lots of reasons for care delays. But in a new graduate, I've seen this time and time again, where they will not deal with a situation primarily because they really feel like they will fail if they try, or they don't have the resources to even know how to deal with it, so they avoid that situation. So keep an eye on the unstable situations that you're putting those graduates in, so that they have enough support to make the decisions that they need to make. Destabilizing clinical contexts, I kind of spoke to that earlier. When it comes to both care delays and the multiple complex patterns that are occurring at the same time, and if they're occurring rapidly, which is what this destabilization refers to. That's why the emergency room context for the new graduate can be problematic, because even if they're following established algorithms, we all know that algorithms are only algorithms, and they're only guides, they're frameworks. Very often a seasoned nurse will interrupt that guideline because they know that if they follow that to its end, it's not going to be effective, but a graduate won't know that. So teaching them algorithms is a great way to prepare them for standard practice. But if things go south, and they go south quickly, it's hard for that new graduate to recover. There is, in the workplace now, we know, a loss of experience knowledge transfer. And I would love to see programs that bring more senior nurses back into practice in a supernumerary fashion, so that they serve as clinical mentors or just SAGE individuals for the entire unit. So we've got work to do when it comes to bringing our seasoned capital back into the workplace. So let's talk about how we can ensure that new graduates are successful. I guess to start with, it would be nice if we could establish more education practice partnerships, individuals who teach but also practice, so that they're in the clinical with the students and in the classroom with them as well. There are many models of joint appointments that we could explore further, and that I would certainly recommend. Final practice experience, it would be helpful if those experiences were synergistic with where they're planning to go. So, for instance, the graduate that wants to go into the operating room to get an experience in their final practicum, but is going on to a medical surgical unit or a mat child unit, might not be synergistic with their transition experience. So the more we can increase their familiarity, predictability, consistency, and stability of that transition, where they're going, who they're going to, where everything is where they're going, the greater the likelihood of their success. Remember that the stages are quite specific, and I think I've made that clear in this presentation. So we need to contextualize the strategies to whatever stage they happen to be in. Understanding those stages and those phases are important for everyone to be on the same page. Individual strategy bundling, and this is where I refer to the instrument, the role transition scale that I have developed, that if you want more information on, by all means get in touch with me. But understanding what each individual new graduate is going through will prepare you and arm you to address their issues more effectively and efficiently. New graduates need to feel like they belong. This is a developmental need that they have. So the more often and the earlier you can bring them into the social community of the unit, the more likely they are to stay there. And I have seen this time and time again, where graduates describe units where they don't feel that way, and all they're thinking about is how to leave. But the units where they feel like everybody has fun and everybody's connected and everybody cares about one another, that's where they want to stay. That's where we all want to stay. Village mentoring. It does take everyone. It's important to have particular people, and when you think about how many people you're using to preceptor or mentor those graduates, initially I would suggest you limit that to one or two, because everyone has different ways of doing things, and that can be confusing for the newly graduated nurse. But once they've got that under wraps, say 4 months, then expand that portfolio of individuals that are mentoring them so they can see different ways of doing things, and they can say, oh, I've not seen it done that way before. Can you tell me a little bit more about why you don't do this or you do that? And that expands their pattern application for ways of practicing, and that's a really good thing. There was nothing that I saw be more impactful with newly graduated nurses than peer mentoring. And I actually instituted that when I was teaching in the clinical area with undergraduate students, and it was very effective. So the more you can get the students together to talk to each other about what's going on, the better off you'll be and the better off they'll feel. Progressive and evolving guided responsibility. So being very cognizant of their very neophyte decision-making, problem-solving, and critical judgment initially, and slowly and very intentionally increasing the complexity or the volume of challenges that the new graduate is being exposed to over that first and second stage, but trying to be very intentional about it. Remember that when they were in school, they received a tremendous amount of feedback. Then they go into practice and they receive virtually no feedback. And that is difficult for them. So the feedback can be in the form of debriefing sessions where, and there's all kinds of frameworks that you can use to spend time with the graduate, maybe as an educator, maybe as a senior preceptor, or someone who's working alongside them, and say, tell me kind of what happened there in that situation for you. And then you can walk them through what you might have done differently had you been in that situation. And of course, I always recommend sandwiching the feedback. That's pretty typical. Tell them something they did very, very well. And then in the middle, situate that segment where, I noticed when you were doing this, that you looked like you were doubting yourself a little bit, or did it turn out the way that you wanted to? Well, here's something that you might think about next time. And then at the end, the sandwich, the other side of the bread, is another piece of positive feedback. Again, I just want to stress the importance of evolving the complexity and intensity. Controlling the chaos that they are experiencing will give them a sense of success. So once they feel successful and feel confident, move them forward. But don't move them forward until they've had that sense of success. So this slide is not rocket science. I think everybody understands that new practitioners need to be supported. They need connection with seasoned mentors and with their peers. But the one thing I don't think that we recognize as much as I would like us to is this idea that they just need time. And even they feel like this sense of urgency that I have to figure this out in the first couple of weeks. No, you don't. You've got a lot of time, and I shouldn't expect you to know that in the first couple of weeks or the first couple of months. We need to give them time to make mistakes, to be supported through an understanding of those mistakes, to reframe their practice, and to go in and do it again. That is simply time. So I just wanted to emphasize that. In my previous slides, I referred to phases of transition. So the stages, as you can see at the top of this slide, are doing, being, and knowing. But there were phases that spoke more to the process that was occurring to get that individual from one stage to the next. The preparation, then the orientation, then the transition. The integration was a part of of the move from being to knowing that indicated that the new graduate had actually adopted practices that were sustainable as a professional nurse. And then stabilization was that feeling from the graduate that they were no longer in a transition, and that they were now moving into the next transition, which would occur after the year was done. It's important for you to note that there are actual differences in the phases, and the next slide that I'm going to show you speaks to the importance of using different strategies and approaches to mentorship and preceptorship in support of those phases. So the framework that I offer here just gives a better sense of what it is that is going on for that particular new graduate in each of these phases of the stages of transition, and how the approach to support might change. An example is moving from transition to integration, where a lot of the focus changes to more of a coaching and an expansion and an advancement of the thinking in complex environments, as opposed to orientation, where the requirement is less for mentorship and more for preceptorship. So I'm hoping that this framework assists individuals who are working with new graduates, and it can be found in my book. I'd like to end with something that I found recently, a publication, a report by Elsevier called The Clinician of the Future. And this was published in 2022. And I'd just like to share a little bit about what their perception is of the multiple interviews that they did with clinicians across the globe, and in different areas of practice, as to what it is the clinician is looking for. So the clinician of the future, first and foremost, is anticipating that they will be a partner with patients and families, that this is not that kind of didactic, hierarchical, powering over relationship that perhaps individuals like myself came into practice thinking. It's far more collaborative and far more mutual for the new practitioner. And it's important that in light of that one recognize how critical the relationships and spending time with patients and families will be to the clinician of the future. Accessibility. Ensuring that there are more accessible and equitable systems that focus on health. So workplaces themselves need to be an extension of that desire for everyone to live a healthier life. So if we are not providing recreational, like gyms, daycares, places to go and decompress, then we're not meeting the needs of the newest practitioner, who is focused on their own health as much as they are focused on the health of the individuals they care for. There is a total health focus for the clinician of the future. So this is about, and it matches the Generation Z so well, this idea of being team focused, of being multidisciplinary, engaging in multiple levels, virtual, digital, physical, and I think ensuring that for, something as simple as being able to utilize their phones during their clinical practice is part of how they function. It's almost an extension of them. So understanding that is important for institutions that are going to be employing these new professionals. And finally, balance. Balance between home and work. And I think that that's been really quite emphasized in all the literature on the impact of COVID on the workplace, when it's intersecting with a new kind of worker. I do think that it's important we assist these new graduates to find that balance that actually we all want. So when we think about what new graduates need and what Nursing the Future offers, the idea of support is pivotal, but so is connection with their peers and with the leaders around them. I think the education speaks to this idea that we all need to be on the same page. We all need to understand the stages and phases of transition so that we can support appropriately as they make it through their first year. And finally, we need to be thinking about how we're going to grow the capacity, the leadership, the clinical capacity of the newest members of our profession, and that is going to involve how do we connect them with their senior mentors.